So I just wanted to talk about a subject that I've been noticing, pop up in social media more and more frequently, and that's body shaming and fat phobia. Um, I never really talked about this before, but I have degenerative disc disease. And basically what it is my spine is starting to rub up against each other, and the bone or the tissue is starting to degenerate over time and get worse and worse. And I used to be in the obese category, I guess. I used to be very overweight. And the first time I went to a doctor about my spine, telling him that I had issues, he just looked at me and said, just lose weight and you'll feel so much better. So you're telling me that even though medically my spine is rubbing up against each other and the bone and tissue is starting to degenerate, that if I just lose fat and weight, I'll magically get better and my spine won't degenerate anymore? That's amazing. You should write a medical journal. I mean, yes, okay, maybe, losing some weight would help take the pressure off my spine, but it wouldn't fix what was already damaged in my spine. That was the issue. And so these doctors, I ended up getting the MRI, and that's how they saw there was degeneration in my spine, in my lumbar and cervical, and I had a reverse cervical spine, which losing weight for a reverse cervical spine, how is that magically supposed to bend my neck in the way that it's supposed to bend? That doesn't make any sense. So they just ended up putting me on opioids, and I got addicted to these drugs. I mean, these are heavy opioids. I'm talking about Dilaudid, fentanyl, Percocet, whatever. And after 5 days, your body naturally gets addicted to opioids. It's just a fact. And I was on them for years, and I could not live without them. And that was the only thing really, giving me any relief. And so doctors did these minor surgeries, they put in a spinal cord stimulator. I've had multiple surgeries on my back and neck, but nothing really helped. Those minor things didn't really help. I was getting injections and none of it really helped. There was always this underlying pain that needed actual surgical intervention. So my husband did some research, and he got me in touch with a doctor in New Delhi, India. I'm talking about I had to go halfway across the world to receive proper medical care, to receive the surgery that I needed. And they ended up putting in a titanium cage in my lumbar and my cervical, and a plate in my neck so it would bend the correct way. And I mean, this surgery, it helped so much. I felt little to no pain afterwards. I mean, obviously after the surgery, I was in a lot of pain from the surgery. But, when I got into PT, physical therapy, and all this other stuff, I got off the opioids, and I've been clean now for 4 years, and it's been great. And, and I ended up losing the weight eventually. I did go in and I got, bariatric surgery. I had the sleeve done. And I did lose 70 pounds because I thought, okay, well, if, my spine feels this good, then maybe if I did take some of the weight off, it would help my spine. It would help it would help, get me out of more pain, and it would take the pressure off my spine. And I can say that, after, I had my surgery done I had the cervical spine, I can't talk today. I had the spinal stuff done in 2018, and right now, after losing 70 pounds, I'm still in the same amount of pain every day. I mean, yes, it's a lot less. I used to not be able to get out of bed. I was in so much pain. Now I can actually move around, and that's because of the physical therapy that's helped me so much. But what that first doctor did to me, by just shrugging it off and saying, just lose weight and the pain will magically go away. That is so wrong. Like, doctors, pay attention to your clients. If they are telling you there is something wrong, they know their body better than anyone else. And if they are telling you that something is going on, something is wrong, take it seriously. It doesn't matter how fat or thin they are. There is an underlying issue. And I'm not, yes, I did get some relief from losing weight. It did help, but not completely. And had that doctor in India not done the surgery that he did, I wouldn't be where I am today. So I just wanted to share that little message of, fat phobia or body shaming or, doctor, whatever you want to call it, doctor issues with fat phobia that's been part of my life in my story. All right, guys, thanks. Bye.